Imagine a day when you wake up feeling off. Not just a little under the weather, but with an intense, throbbing pain in your head that won't ease, accompanied by a fever that just keeps climbing. It is a deeply unsettling experience, and your body is sending clear signals that something significant is happening. When you experience both a high fever and a severe headache, it is a strong indicator that you should seek immediate medical attention. These combined symptoms often suggest a more serious underlying condition that requires prompt professional evaluation and diagnosis to ensure your well-being. These specific symptoms are particularly concerning because they can point to infections or conditions affecting the brain or its surrounding tissues, which are critical for your body's function. For instance, a very high fever often signals your body is fighting a significant infection, while a severe headache could indicate inflammation or pressure within the skull. One of the most urgent possibilities is meningitis, an inflammation of the membranes surrounding the brain and spinal cord, or encephalitis, which is inflammation of the brain itself. Both conditions can be caused by viruses, bacteria, or fungi, and bacterial meningitis in particular can progress very rapidly and lead to severe complications or even be life-threatening if not treated quickly. Other potential causes might include severe influenza, certain types of pneumonia, or even less common but serious issues like a subarachnoid hemorrhage, which is bleeding in the space surrounding the brain, causing sudden, explosive headache often described as the worst headache of your life. Because the stakes are so high when the brain and central nervous system are involved, a medical professional needs to perform tests to accurately pinpoint the cause and begin appropriate treatment without delay. If you or someone you know develops a high fever and severe headache, the most important step is to contact a healthcare professional or go to an urgent care center or emergency room right away. While you wait for medical help, you can try to keep comfortable by resting in a quiet, dark room, but do not delay seeking care. When you speak with the medical team, be prepared to describe your symptoms in detail. Note exactly when the symptoms started, how severe they are, and if anything makes them better or worse. Mention any other symptoms you might be experiencing, such as sensitivity to light, a stiff neck, vomiting, confusion, or a skin rash. This information is crucial for doctors to make an accurate diagnosis and decide on the best course of action. Beyond the initial symptoms, there are a few specific warning signs that healthcare providers call red flags, which can indicate extreme urgency. One is a nuchal rigidity, commonly known as a stiff neck, which makes it very difficult and painful to touch your chin to your chest. Another is photophobia, an extreme sensitivity to light, where even dim lighting feels unbearable. Altered mental status, such as confusion, disorientation, or difficulty waking up, is also a critical symptom. Finally, a sudden spreading rash that does not fade when pressed with a glass, often called a non-blanching rash, can be a sign of a very severe bacterial infection. Recognizing these additional symptoms provides valuable information to medical staff and can help them quickly identify the most serious conditions. Ultimately, experiencing a high fever alongside a severe headache is your body's way of telling you to pay close attention and act decisively. By understanding that these combined symptoms warrant immediate medical evaluation, you are taking a proactive and responsible step towards protecting your health. Early diagnosis and treatment are absolutely vital for addressing the underlying cause effectively, providing you with the best possible outcome and restoring your peace of mind.